only high of 60 today. You know what that makes us think of? Makes us think of flu season. Yay! Joining us now, spokesperson for the American Academy of Pediatrics and our pediatric expert, Dr. Elizabeth Murray. Welcome.
Hello.
It's that time. I just got my flu shot about a week ago.
Me too. And we're both still here, and we feel fine,
yes,
right?
Yes.
Okay.
I felt just fine. I was able to continue on, and I know a lot of people say, I get the flu from it. No,
can't
you
do
don't.
it. No.
Oftentimes, if that's happening, people probably already had something brewing.
Yes, I think there's a couple of things at work. One, either you're in a doctor's office where there's lots of other sick people, and so you're catching something when you're there. Or two is, remember, this is the time of year where germs are spreading at a much greater rate. We're a couple weeks into the school year, and so kids are sharing. We teach them to share, and they're sharing their germs, and so just the overall viral illness load to the community kind of goes up around this time of year too. So it really is coincidence. It is not possible to get the flu from the flu shot.
And the debate, do you get one, do you not? Your doctor, you say yes.
Almost definitely.
So let's move on from there.
Yes, yeah, so that's a given.
So we're talking about for the kids. They have to be 6 months old or older, correct?
Yes. So that's one of the most important points. So we have a huge population of little babies out there who can't get protected. So as a parent, get the flu shot for yourself. Even if you don't think you're going to get the flu, you're doing it to protect those little 6-month-old or less babies out there who can't get the shot. So anybody older than 6 months can get it. You can get the nasal spray if you're over 2 and otherwise healthy, as long as you're under 49. But other than that, you can get the shot. Most offices will offer both, and it's an important reminder of this is why you really need to talk to your pediatrician or your family doctor about which type is best for you, because there are some children who really shouldn't get the nasal spray, and those are children who again are under 2, who have a history of pretty severe asthma or other respiratory illnesses, and that's just because you can get a little bit of a runny nose after you get the nasal spray, and so we don't want that to trigger another disease that they have. So both are totally safe as far as vaccine reactions, things like that. But we know that there's some people that just will do better with one version versus the other.
Okay, so it's kind of specific.
Yep.
If I have a healthy 5-year-old and they say, which one do you want? Does it really matter?
You can actually let your 5-year-old choose at that point if you want. I mean, they might be kind of excited to have to be able to make a little bit of a choice. My daughter did choose the spray, and she said it was like a hurricane up her nose. But she thought it was better than a shot, so that's okay. You know, give them a little bit of autonomy there to let them make the decision, because understanding that they're doing something to keep their body safe is a really important message for the children too, that it's an immunization, it's a vaccine to keep them safe.
Oh, I like that. Bring up that discussion early. We're a few weeks into school. I imagine the earlier you can do it, the better, because those germs are going to start flying. Yes,
and so we know that it takes about 2 weeks to get full effect from the vaccine. So you need to get it as soon as possible. We like to get everybody vaccinated before Halloween if we can. Some offices still don't have them in our community right now, but check in with your doctor. If they do, go ahead and get it.
You mentioned having a discussion with your doctor. I know places like different pharmacies also offer them as well. Is it okay to stop in?
So for adults, yes. They don't usually do offer them to children, so it's usually an over 18, and that's fine. Again, we like to have people keep vaccinations within their medical home just so there's a record of it, and so it's tracked, because there are sometimes some subtleties, and again, knowing the person's medical history, every once in a while there's going to be a subtlety that perhaps a provider that's not familiar with your background won't necessarily know. So we recommend keeping things within your medical home, but if the option is flu shot versus no flu shot, get one where you can.
Gotcha. You got a month to go. You've all been warned. Put it on the calendar. Thank you so much. We appreciate it. Hurricane up your nose. I like that. Local headlines are coming up next.